Nerve supply of the face. In the previous video, we learned how the face is important for personal identity and has unique features such as a highly vascular skin and specialized facial muscles. We also learned how these muscles control facial expressions and orifices such as the eyes, nose, and mouth. In this video, we are diving into the nerve supply and its clinical anatomy. Let's begin with the motor nerve supply. This refers to the nerve or nerve fibers that provide the necessary stimulation to activate and control the movement of muscles, mainly the facial nerve. So where does this facial nerve come from, you might ask? It originates from the brainstem and travels through a narrow bony canal in the skull, called the internal acoustic meatus. It then exits the skull through the stylomastoid foramen. From there, it winds around the styloid process and finally enters the parotid gland, the saliva factory in the face. But we're not done yet. The real magic happens at the parotid gland's anterior border, where the facial nerve splits into 5 terminal branches. That's right, 5. And they've all got fancy names. The temporal, zygomatic, buccal, marginal mandibular, and cervical branches. So what do these 5 branches do, you might ask? Well, they emerge in the face and supply the muscles of facial expression, which is a fancy way of saying they are the reason you can make all those funny faces in the mirror. And if you're feeling particularly bored, you can try to remember the 5 branches by placing your palm on your auricle and spreading your fingers. So, to summarize, we have the facial nerve, from a hole in the skull to a fancy dinner party to a secret handshake. Let us look at the clinical significance of the facial nerve. When the facial nerves aren't performing at their best, things can get weak, and that's where Bell's palsy comes in. Bell's palsy can strike without warning, causing facial paralysis on one side of your face. And while the actual cause is unknown, it's thought that a viral infection is to blame. As the facial nerve becomes compressed close to the stylomastoid foramen, the lower motor neurons that control your facial muscles start to misfire. One of the most noticeable symptoms of Bell's palsy is facial asymmetry. The damaged side of your face is attracted to the healthy side, causing an uneven appearance that can be difficult to ignore. As the condition progresses, you may notice a reduction in your horizontal forehead creases. Your palpebral fissure may start to widen, making it difficult to seal your eyes shut, and tears may start to run down your face due to paralysis of the lower orbicularis oculi muscle. As the zygomaticus major muscle becomes paralyzed, the angle of your mouth may start to sag on the affected side. You may also notice a loss of the nasolabial furrow due to paralysis of the levator labii superioris alici nasi, and food may start to build up in the vestibule of your mouth due to the paralysis of the buccinator. And if that wasn't enough, you may also experience saliva dribbling from the corner of your mouth because of the paralysis of the orbicularis oris muscle. But the good news is that in most cases, Bell's palsy is a temporary condition that resolves on its own within a few months. The treatment options available reduces symptoms and gives the patient confidence. So, to summarize, we have a table on the next 2 slides displaying the innervation of muscles of facial expression. Take a quick screenshot if you'd like to. Pop quiz. Several tests can be performed to evaluate the function of the facial nerve in the face. Here are some of them. Facial nerve grading system. This is a commonly used method to assess the degree of facial nerve weakness or paralysis. It involves evaluating the symmetry and strength of facial muscles on both sides of the face while performing specific facial expressions, such as smiling, frowning, and closing the eyes. Electromyography, EMG. This is a diagnostic test that measures the electrical activity of facial muscles by inserting small needles into them. It can help identify the location and extent of nerve damage or dysfunction. Nerve conduction studies, NCS. This is another diagnostic test that measures the speed and strength of electrical signals traveling along the facial nerve. It can detect abnormalities such as nerve compression or demyelination. Magnetic resonance imaging, MRI. This imaging technique can provide detailed pictures of the facial nerve and surrounding structures, helping to diagnose conditions such as tumors, inflammation, or trauma. Reflex tests. These tests involve tapping the facial nerve at various points on the face to assess its response and sensitivity. Let's now learn about sensory nerve supply. The sensory supply of the face involves the transmission of sensory information from the skin, mucous membranes, and other structures of the face to the brain for interpretation. The main nerves involved in this process are the trigeminal nerve, cranial nerve number 5, and the facial nerve, cranial nerve number 7. The trigeminal nerve, also known as the fifth cranial nerve, provides sensation to the whole face, except for the skin over the angle of the jaw, which has its own personal nerve, the great auricular nerve, C2, C3. The trigeminal nerve has 3 divisions, ophthalmic, maxillary, and mandibular, each with its own territory to cover. The ophthalmic nerve supplies sensation to the forehead, upper eyelid, and nose. The maxillary nerve supplies sensation to the lower eyelid, cheek, upper lip, and teeth. And the mandibular nerve supplies sensation to the lower lip, chin, and teeth. The great auricular nerve is a branch of which of the following nerves? A. Trigeminal nerve. B. Facial nerve. C. Glossopharyngeal nerve. D. Cervical plexus. The correct answer is D. The great auricular nerve is a branch of the cervical plexus, which is a network of nerves that arises from the spinal cord in the neck region. It provides sensory innervation to the skin overlying the external ear and the angle of the mandible, as well as a small area on the lower part of the face and neck. Pop quiz. So there you go, folks. This was all about the neural supply of the face, both sensory and motor. In the next video about the face, we will look at the arterial supply and lymphatic drainage. We hope you had fun learning with us.